today I'm going to talk about what to do once you do have your braces or your Invisalign. Basically the aftercare, how to take care of them, what you're going to experience right after, and then also some emergencies that might pop up. So if you have Invisalign, basically you can eat pretty much whatever you like. There's nothing that you have to really worry about as far as breaking any brackets or having your wires slide around or poke around. So you can pretty much eat whatever you like. You do have to consider that you need to make sure you're wearing your aligners. They should be worn 22 hours a day. So, as soon as you take them off to eat, as soon as you are done eating, you want to brush and put them back on. It's very important that you brush your teeth when you have your Invisalign, just like with the braces. If you eat something really acidic or sweet and then you put your aligners back in, you're trapping all of those sugars and acids in your teeth, which of course leads to cavities. So make sure you're brushing your teeth and make sure that you're brushing your aligners. If you don't have a sulfa allergy, you can use denture tablets like Effordent, things like that they sell at the stores. And you just get the little tablet, put it in a little cup of water, and it fizzes up, and then you put your aligner in the cup, and that helps to loosen up any debris or anything on your aligners. And then you can just use your toothbrush and very gently clean that off. If you have braces, of course, you have to be careful about what you're eating. You can't have anything really sticky or hard or chewy. You can't bite into anything pretty much. Anything that's harder than, say, a hamburger or a hot dog. So nothing hard. That includes hard chips like tortilla chips, Fritos, Doritos, Takis, any hard tacos, taquitos, tostadas. You can have soft tacos. You can't have the hard tacos. You can have soft chips like the puffed chips or the Cheetos that are the puffed Cheetos. Those are okay. You can't have the regular hard kind. Also, you can't have anything sticky. So now and later's, Skittles, Starburst, Taffy, caramel, anything that's sticky. Because what that does is it sticks to the bands or it sticks to the wires or the brackets, and it can pull off the bands, the brackets, it can slide the wires around, and then you end up with a pokey wire. So you need to stay away from anything like that. Also, you can't bite into anything hard. So apples, corn on the cob, ribs, chicken wings, anything hard like that you can't bite into because it'll break your brackets off. You can still have those foods, you just have to cut them up. So slice up your apples, cut the corn off of the cob, the ribs, you have to just, pick them with your hands, or the wings, pick them off with your hands. You can't bite into anything. You can bite into softer things like soft sandwiches, hamburgers, hot dogs, things like that. So brushing and flossing is very important when you have your braces. Without brushing and flossing, if you go a long time and you eat and you just leave the food on there, what happens is the bacteria in your mouth starts to feed off of that food, and it creates acid. Acid is what starts eroding your teeth. It starts leaching the minerals, the calcium out of your teeth. Basically, the beginning of a cavity. It's called a white spot lesion. You get a chalky white spot on your teeth, and it's not reversible. It doesn't go away. You can't bleach it away. It's something that's permanently there. It's almost like a permanent scar on your tooth. So you need to be really careful when you do have your braces to make sure you're brushing after every time you eat, and definitely flossing. Now, flossing is definitely harder when you have braces because you have to get under each wire to clean everything off. But you have to do it, or else your gums are going to get really puffy, they're going to get swollen, they're going to start bleeding. It's called gingivitis. The good thing is gingivitis is reversible. So if you start flossing and brushing, after a couple weeks, it will go away. Same thing with the Invisalign. It's definitely a lot easier with the Invisalign to brush and floss. You don't have to go under any wires or anything. So it's just, brushing and flossing like regular. You just have to make sure you actually do it. So after you get your braces put on, for about the next couple days, you're gonna feel some soreness. Same with the Invisalign. For the first couple days, once your teeth start shifting and moving around, you're gonna feel some soreness. And that's totally normal. I do recommend some soft foods for the first couple of days, so you're not having to bite or chew onto anything that's uncomfortable. And if you need to, you can take a painkiller as long as you're medically okay for that. Usually ibuprofen works the best for orthodontic pain. You don't want to take it too often or for too long, but for the first couple of days, I think it's okay. So now I'm going to go over with you guys what to do in case of an emergency. So in orthodontics, a true emergency is pretty rare. We really don't see like kind of life-threatening emergencies. Of course, if you do have a true emergency, always call your orthodontist's office right away. If not, make sure you go to your dentist if it's a life-threatening kind of emergency, which of course doesn't really happen with orthodontics, but always go to the hospital, go to the emergency room. If you have any kind of orthodontic mishap happen at home, so for example, a pokey wire or a broken bracket, I'm going to give you some ways to take care of it at home. So if you have a pokey wire that maybe the wire slid over in the back and it's poking you, that's what wax is for. Wax is your best friend, especially in the beginning. So you can just get a little piece of wax and just stick it on that wire in the back that's poking you until you can come in for your appointment. Of course, give your orthodontic office a call so that they can get you in. If you have a broken bracket in the front and it's bothering you, give your office a call, give us a call, and we'll try to get you in as soon as possible to fix that bracket for you. If it's a broken bracket and it's in the back and it's not bothering you, just give us a call so that we can schedule a longer appointment for you for next time, but it's not anything to worry about. Your teeth are still going to be straining up in the front while that one bracket's off in the back, so it's nothing to worry about. If it is bothering you and you can't get in right away, you can just stick a little bit of wax on there, and that'll help to kind of buffer your cheeks or lips from the bracket that's moving around and maybe bothering you. In the beginning with braces, some people get ulcerations in their mouth, and that's just basically your lips and cheeks on the inside. They're not used to having something new there, and so when it rubs up against it, it can cause a little ulceration. Again, wax is really good for that. You just put a little bit of wax on whatever part's bothering you, and that usually helps. And warm saltwater rinses are very good for that too. Just doing some warm water and putting salt in it, swishing it around, spitting it out, doing that a few times a day will help for those ulcerations to help them heal. So as you can see, taking care of your braces or aligners, it's not difficult. You do have to keep some things in mind, like what to eat, what to avoid, and making sure that you're brushing and flossing to keep away any white spot lesions. And if you do everything as instructed, your treatment should go very smoothly and you should finish in a timely manner.